name's Sarah Wheatley. I'm one of the operations managers within Care Visions Fostering, and I've been with Care Visions for 11 years.
So I'm Liz Harrower, I'm a Therapeutic Family Worker and I've been with Care Visions for 14 years.
Therapeutic crisis intervention for families is basically training which will give you strategies to manage the young people in your care's behaviour. It will also help you understand the reasons why they behave in the way that they do. It will give you an understanding of trauma and the impact that has on a child's development and attachment. So the most important thing I think you'll learn from undertaking the training is how to respond in a way that isn't going to escalate the behaviour further. Mm-hmm. So it will help you keep the child kind of from being triggered and keep them calm and give you the confidence to care for the child. So that's one of the benefits of therapeutic crisis intervention. And it will also give you strategies to build relationships, to communicate better with a child in your care, and if the child is kind of behaving in a way that's challenging, then it will also give you the confidence to manage that.
So one of the things that we know was really difficult for foster carers when they first became foster carers, and they had attended their skills to foster, and then they had children in placement in their homes, and we knew that it was really difficult for foster carers then to do what was best for that child. They were always looking at what was best, how do I best meet this child's needs, how do I best react to different things. So we looked at how we could support that, and we brought in training prior to foster carers having children placed in their homes. And that training is to help the foster carers have the confidence, so when that child comes into their home, they know that child might struggle with certain things like eye contact, and they know to expect that then. So they then know how to deal with that situation. They feel much more confident in how to approach that with the child, rather than being really worried about these kind of small things that we can support them through in the very early stages.
One of the things that the training will provide carers with is how to get that child on a routine, and it also kind of identifies that if a child's kind of lived in a household which has been quite chaotic, there's been a lot of physical violence, that they might struggle with certain kind of like normal kind of bath times or night times might be a potential area where the child's quite distressed. Mm-hmm. So we spend a lot of time within the training thinking about just routines and how to get that child in a routine. We talk about how important a routine is.
How to make that as safe as possible for that child in their placement. Because it's about trying to support the child to feel safe in these kind of daily interactions and these daily routines. So it's looking at how we do that in a way that feels safe for the children.
And it's also about kind of recognising that a lot of our children haven't had bedtime routines, they haven't sat down at a table to have their meals, so these are things that they're learning. So it's about kind of being realistic in your expectations, and quite often with some of the children that we're caring for, it's about little small steps like using a knife and fork are really, really significant, and those are kind of some of the things that our carers say are, it's really rewarding when a child is sitting having their tea, or so it's just really breaking it down and giving you lots and lots of strategies to cope with every day, because everyday kind of activities can be quite difficult for our young people that we're caring for. Mm-hmm. So one of the things we recognised as an agency was that in order to kind of ensure that carers had the best support, we needed to ensure that every member of staff that works with you as a foster carer is trained in the same strategies. So all the managers are trained in therapeutic crisis intervention. You'll be allocated a supervising social worker who will know the strategies and how to use them and can support you to use them. You will also be allocated a therapeutic family worker who will be really skilled in using these strategies, and part of their role will be to help you implement them in your home. So what we constantly revisit is, are they working? Can we think of something else to do? So you're never alone. You'll have lots and lots of support, and it won't just be like a one-off training. We have completely integrated it within the agency so that everybody knows about it and responds in a way that's trauma informed to the care of the child. So that's one of the benefits of ourselves as a fostering agency.